Thank you, Christina. Today is Medical Monday, and if you didn't know, March is Endometriosis Awareness Month, designed to bring attention to the condition that impacts about 200 million women across the world. Dr. Saqib Ahmad is the chairman of OBGYN department at Hurley Medical Center in Flint. He joins us live this morning to help us learn a thing or two. Good morning.
Good morning, Matt. Thank you for the invite again.
Yes, good to see you again as always. So,
you too.
First off, tell us a little bit more. What exactly is endometriosis?
So, as you said, it's a condition which is impacting a lot of women, and actually the incidence is like 1 in 10 reproductive age women. It's a condition in which cells which are similar to the lining of the uterus, which also known as endometrium, and that's where the name is derived from, start growing outside the uterus. Endometriosis often involve the pelvic tissue, can wrap around the ovaries, fallopian tubes, bladder, bowel, colon. And so during menstrual cycle, what happens is tissue responds to the hormone fluctuation, and due to its location, frequently results in pain. And then this endometriosis causes surrounding tissue to get irritated, potentially develop scarring, sticky fibers that bind together, and sometimes it also results in the ovaries and known as endometriomas. So definitely it's a quite impactful condition and leads to a lot of morbidity in the woman.
Yes, so with all that said, talk about the importance of bringing more attention to this condition.
Yes, definitely. The thing to understand is there are no good reason explainable in the literature why or who gets it. But there are different theories are out there which sparking this tissue to grow outside of uterus, and exact cause is still uncertain. But there is one theory is in recent literature we're looking at, which is saying that the development of endometriosis actually start occurring during the development of fetus. So basically when baby developing inside the uterus of its mother, that's when endometriosis actually starts. Some other conditions which make you more prone of having endometriosis, for example, you've never been pregnant in your lifetime, more frequent menstrual cycles you're having, and you're having a menstrual cycle which is lasting longer or have a very heavy blood flow, very low BMI, like in 16, 17 BMIs, structurally abnormal reproductive organs, including the vagina or cervix, some family history, even though it's not a genetic disorder, and starting your menstrual cycles at very early age, like 8, 9 years of age, can increase your risk of having the endometriosis.
And then finally, before we let you go quickly, what's the importance of making sure that women get proper treatment?
So, first of all, understand this is very important, that you cannot diagnose endometriosis just because of your symptoms. So now what you understand here is your symptoms might make you suspect endometriosis, but unfortunately the only way to say 100% if you do or do not have endometriosis, you have to go through a minimal invasive surgery, because during surgery we can remove that tissue, look under microscope and confirm 100%. Most of the times ultrasound, MRI, CT scans are not helpful, because usually these endometriosis is very superficial. In other words, like that is almost like a paint spackling on a wall.
Sure.
Well, we cannot see that, but some conditions, as I said earlier, where it causes the cysts in the ovaries, and those cysts, those are what we call is the deep infiltrating endometriosis, and can grow inside ovaries,
so it may be trickier
or bowel.
to diagnose there. Well, listen, we're almost out of time, so thank you so much, Dr. Ahmad, for your insight this morning. We really do appreciate it.
Thank you very much. I appreciate your invite again. Take care. Have a good day.